Currently, about 70 of our state's most vulnerable children with severe mental health needs are receiving treatment out of state, some as far away as Oklahoma.
That happens because the state does not have a secure residential treatment facility. But that's about to change as Sweetser is close to starting construction on the state's first facility for children. And as News Center Maine's Vivian Lee reports, the final funding decision now rests with state lawmakers.
And then over here will be the dining area.
Christy Worster, Chief Program Officer at Sweetser, says the community health organization plans to turn a former residential unit on Sweetser's Saco campus into Maine's first psychiatric residential treatment facility called a PRTF.
7 bedrooms down this side.
The 8,000 square foot building will have 16 beds for Maine's most at-risk children and teens. It will include activity rooms, sensory spaces, a nurse's station, and a basketball court. The goal is to turn these walls into a safe home-like place for inpatient treatment that could last for 9 months.
And with the stencils on the outside, we want the room to be, a therapeutic color, to have a light on the wall.
Not here.
Currently, about 70 Maine youth with severe mental health needs are being treated out of state, some as far away as Florida. State health officials say more than 100 other children are waiting to go out of state. This means families are separated by long distances and care for children is delayed.
We have children in Maine that are stuck in emergency rooms. It's not acceptable to any of us.
The facility will cost $7.9 million. Sweetser received $2 million from the Maine Department of Health and Human Services and plans to raise another $2.5 million from corporate partners. Governor Janet Mills included the final $3.4 million in her supplemental budget, but it still needs approval from the legislature's Appropriations Committee.
I do feel like there is agreement on both sides of the aisles on the need for this. I think, we've been advocating, rallying, lobbying about this for several years.
Some advocates warn that recent proposed changes to MaineCare, the state's Medicaid program, under a settlement agreement with the Department of Justice, could reduce home and community-based services for thousands of children with autism, intellectual disabilities, and other needs. They are concerned that more kids in crisis could be overlooked.
We're just asking them to be institutionalized. Do I think we need PRTFs? Right now, I think we need a wide range of services.
A key feature of the project is a family apartment on campus so parents and guardians can stay nearby and stay involved during the months-long treatment process. In Saco, Vivian Lee, News Center, Maine.
The proposed supplemental budget is expected to be voted on by state lawmakers by the end of next month.